Morning. Good morning. Can y'all hear me? Good. I know break was really, really good, right? Are the apples and oranges amazing? So, good morning. My name is Lauren Eldridge. I'm the coordinator of diversity, equity, and inclusion. We're going to switch gears here, and we're going to have some activities for y'all to do. And I say y'all because I spent a lot of time in the South, and it's a gender-neutral pronoun. I use she, her, and hers, by the way. So first up, we're going to have Emily Pillai. She is the education manager at the Community University Health Care Center, also known as COOC. We were just talking about that weird acronym. And then Darren and myself will lead an activity right after that. Darren Kaltbed is the Associate Director of Career and Development Center.
Close. Career and Professional Development.
Okay, I did my best, right? And so we're going to hand it over to Emily and take it away.
Thank you. So as she mentioned, I'm the education manager over at the Community University Healthcare Center. What that means is 3 years ago, they wanted an actual educational model for this center, which is owned by the university and works with refugee and immigrant health. So our patient base is only 17% of European American descent, to give you an idea of who we are. 22% Somali. I can go into the statistics, but it's how do we work with the students that rotate through there, including the patients in their education and in the faculty education. And what I brought with me is what I call narrative health. I have a background in creative writing, but creative writing for social justice. And how do we use creative writing, and more importantly, how do we listen to stories and tell stories and share them in a way that can teach us about health and that can really help with health equity? So our objectives for this time is to be able to define what narrative health is, to identify the importance of story in public health and our communities, and to write a 6-word memoir. You will be able to write it, and I will ask you to share. Not everybody, though. So narrative health comes out of the history of story as healing, story as community, and story is something that is powerful in our lives. I do want to note here that narrative health is just a word, and a lot of times we rename things in order to get buy-in or get grants from different organizations. So it's a word to translate what communities already do into a way that these bigger structures can understand the importance of it. And I open it with physicians because I just went to a lecture on how public health split off from physicians. And the physicians used to be seen as the core of public health. Think of Dr. Quinn, medicine woman, right? She's in the central, she's in the town, she takes care of the whole community. Somewhere along the line, the systems changed, and that somewhere is with the Flexner Report in 1906 or 07. And education changed out of the communities and into this, there's health in the body, and then there's public health, and they're these separate entities. Mental health somehow got separated out. As the mind is different, dental health, your teeth is different. So we started to separate the bodies. But then narrative medicine started to come along in the 2000s based out of medicine, where a doctor said, I don't know how to connect to my patients anymore. We speak in stories. I need to learn how to speak in these stories with my patients. So narrative medicine came out of medicine. I'm switching it to narrative health because I want to go back to the community of storytelling and to honor the fact that storytelling comes from the communities to begin with. It doesn't come out of medicine. And putting it back in public health, but trying to bridge the gap and combine medicine and public health again, recognizing that through storytelling, we can find out how people define their health and what healthy means, instead of us telling them what it means to be healthy. Recognizing how we tell stories, not even just about health, but about others. If I go to doctors, you can tell how we view them based off of how they've progressed on television, right? There's never a show about a public health professional, but there's always shows about doctors, and they've gone from Dr. Quinn, medicine woman, to House, the bitter, jaded doctor who knows what's right, and that paternal figure. And then after House and kind of in the middle came Scrubs, where it's the doctor who's trying to figure out where in the world they belong while dealing with that older generation. So when I talk about storytelling, it's a good way to see even what's important in a community by the stories being told and how institutions are viewed within those communities. Example that I wanted to bring about how we recognize these stories is the measles outbreak in Minnesota. And this is going to be like a call and answer. And you guys, if we don't hear anybody from your students, I'm going to call on you. But what were some of the stories that you've heard about with this outbreak of measles in Minnesota? Anybody can just shout. We won't even know who you were, unless you want to raise your hand. It's happening at Hennepin. So we have a location. It's not just Minnesota, it's Hennepin. What other stories do we have? Yep, Somalis, you got 2 in 1. Somalis don't vaccinate. The fear in that came from, there is a high autism rate among Somali children in Minnesota. So you got 2 in 1. And I'll just go through, and then because of this idea of a link between autism and vaccines. So these are stories that we've heard going on around it. There's stories within those stories, but one other story that we didn't hear as much, is that autism is a bad thing and that it's always a bad thing. And I want you to consider that. I love this comic. It has the woman saying, wait a minute, autism spectrum people are overrepresented in research science, but that means the gentleman saying, my God, autism causes vaccines. And there is research to back this up, that those in these science research fields score higher on the autism spectrum than others. And I have many a friend who has Asperger's who recognizes it as being neuroatypical. It just means I don't think the way that others think. But when we always frame something as an ultimate negative, it adds to these other stories that can lead to a crisis. And that's part of the story. When I say look for the stories that are there, look for the stories that aren't there. The story that autism is always bad is there, but are you recognizing that as a story that needs to be addressed? The idea that an illness at all levels is always a negative thing. And yes, my friend is in government policy, and she does a wonderful job at that because she's such a stickler to details. And she loves it, even if she gets frustrated by other people who do not honor governmental policy. And she does an amazing job. And she also always calls me out when I start to think of things in a typical manner or start to say things like, always, and stuff like that. Get a friend who'll call you out. So looking at that with narrative health, what I want to ask you to do and what I want people to do with it is to explore all the stories that are at play and is focused on health, so around health. To be able to thoughtfully and intentionally examine who is telling the story, which is really important, because a lot of the news were not people from the Somali community talking about the Somali community and what happened and why it's so high. To be able to examine how people are telling the stories, medium counts. As somebody brought up the other day, sometimes they feel the truer test is what's being told on Facebook versus what you see in the newspaper, because one is much more of the ground level people, and the other has a lot more filtration going through it. Really paying attention to how you're listening. Are you listening to respond to something? Because then you're not really hearing what's going on. You're hearing what you need to hear to be able to respond instead of honoring that story. And if you're sharing, that's a huge part too, because if you're part of a community, then don't just take the stories from the community. It's vital that you share perceptions as well, because then we all get a much more rounded idea. Who is doing the defining and what is being defined, and the importance of listening to your community with a thoughtful ear while not being outside of or immune to the stories, and being aware of that. So the way that I use narrative is as a connection between the patient community. Here we have past medical history, symptoms, diagnostic tests, community, with the clinic. So we do have patient sessions where patients and students come in and speak together and just sit down over a meal and share stories. And it's guided a bit, but the point is students learn to listen, patients tell us what really matters. And I had a patient on Friday who's been coming, a Somali man, and he has given me permission to share what he talks about. And his story on Friday was healthcare, Healthcare knows no race. Not healthcare, mental health knows no race. So it was about him and his mental health issues that he's been having, and recognizing that there isn't a race attached, but sometimes he's treated like there's a race attached to him having these mental health issues. And that was really eye-opening. And it crossed all those boundaries. And recognizing that when people tell stories, it can justify their decisions and the behaviors of the narrator. If somebody's telling you something, they're telling you a rationale behind the way that they're thinking. And it can ask for a request for changes in behavior towards the narrator and the community or us. When we hear stories like his about how he feels that he's treated differently because of his race in connection with his mental health issues, then we know that we have issues that we can address. It's also wonderful for empathizing with people and to motivate both the narrators and the listeners. These patients that have been coming for the past 8 months every single time we have it, and they're becoming more active in the clinic because they're feeling more connected and forming that community. Ooh, I went really fast, didn't I? Good. So with that said, I am going to ask you to write your 6-word memoir. You should all have index cards, I was told, are handed out. Instruments for writing. It's in their folder. All right. So the way that I do writing is a very guided exercise, which we're going to do now. So, did I have my notes here? These are examples of 6-word memoirs. Oprah, and I will always say that somebody else wrote this because it feels way too Oprah, is seeking the fullest expression of self. I mean, Oprah's Oprah, it could have come straight from her, but Deepak's danced in fields of infinite possibilities. So when I say your 6-word memoir, this is your beginning, right, orientation of your career as a public health professional. To think of your memoir as a public health professional, who do you want to become in this field? What drew you to this field? And step 1 is to write down 5 moments that started you on your path. We like to think epiphanies come in this flash. They don't always. Sometimes they're slow burns. So think of those slow burns. If I think of how I got this idea to do creative writing in healthcare, part of it is seeing a flyer when I used to work in a cancer center that was hiring artists in residence to work with cancer patients, specifically on writing their stories. And that made me realize that there's a big connection, and it's not just straight art therapy, it's something else. So that would be one moment for me, looking at that flyer. You got 5. I'm using you guys as a gauge. So hopefully people have more than one. You don't need to have all 5. Part 2 is I want you to choose one of those 5 and break it down even more into 5 moments. So it can be what's going through your mind, like when I was looking at that flyer and I was thinking, this is really needed. How come we don't have it for other things? I know that there's therapy, or I was examining where I was in my life. That was a big thing. But what are those moments within that greater moment that you choose from part 1? Make sense? All right, I see a number of pens are down. So from there, you can either choose one of those moments and from that create your 6-word memoir because you've drilled down into it. Syntax is your friend. Feel free to use commas and semicolons freely. You can examine the moments as a whole and see that overall feeling that you might be feeling now to write down, entering into this, kind of like your personal motto. What is your 6-word memoir as a healthcare professional, public health professional? see some pens still working, some not. I've done this at a number of conferences, and I told you in the beginning, I will ask people to share. Because part of this, and doing this specific one, and especially at orientation, when I was approached, is sharing our stories with each other and creating community together. So you know how I mentioned in the slide, you have to share with each other. I shared my story and what I do. So now I'm inviting you, and if you don't feel comfortable, you don't have to, but if anybody would like to stand up, I don't know if we have a mic going around, but saying very loudly what their memoir is, if they'd care to share.
Okay, so I teach at a high school for youth at risk, kids that have seen parents murdered, and they come into school with the ankle monitors on, and so I hear their stories all the time. I'm the school nurse, and I also teach child development because many of them have children. Some of them have multiple children. And so I hear their stories. And when I first started working there, I had a girl come in who came in with back pain. And she said that she was diagnosed as just a pulled muscle, but this had been months. So we started talking to her about it, and she said that she hurt her back when she jumped out a window. So we said, okay, well, why'd you jump out the window? She said, well, we all were jumping out the window because the robbers were coming in the house and they were shooting at us. And her 5-year-old niece was shot in the head and died. And so that was a very eye-opening experience for me between, the struggles of the very poor population. This is in San Antonio. And that was something that, I had never witnessed. I had never thought about what these kids go through. And so that was my experience, and it just really opened my eyes, and it made me want to see what can I do to help them, what can I do to change their history so they're not repeating the mistakes of the past, and they have, they can make better decisions, they have better health literacy, they can make better decisions, and they can maybe avoid all that, because it turned out it was her uncle's drug deal that went bad, and so that's what caused the whole thing.
Cool. Thank you. Were you able to use that story to create your memoir?
Yeah, so my memoir is just that moment of that epiphany when it really opened my eyes to the struggles of the people around me.
Cool. Thank you so much for sharing. Would anybody else care to share their memoir, or perhaps what made them want to become a professional?
Hello, everyone. My name is Hillary Lohr, and I'm in the Division of Community Health Promotions. And my 6-word story is, first Hmong generation found her voice. And the reason why I'm here today is because I'm Hmong, and I'm a first-generation scholar in my family. And growing up, my memoir was, I was in poverty, my parents didn't know English, and I was bullied, for being Hmong. But that's what helped me found my voice in coming here, wanting to advocate for other, young women who experience what I went through as an immigrant, as a refugee. And that's why I totally connect with narrative health, because it's the stories of, our ancestors and our people who worked so hard and sacrificed themselves to be why we're all here today.
Thank you so much.
Thank you.
Fabulous. My name is Cole Hansen. I'm with the School of Public Health, Nutrition. A lot of words. So my 6-word memoir is using tools, not talent, to heal. Because I feel people are very limited by what they feel their talents are. And I have bumped into many situations where I have no talent. But I can have the tools, and I can use the tools, and I can learn the tools. And I think tools are a big part of the healing process, and whatever we use, it's important to understand them and know that you can learn. Talents aren't learned. Tools are.
Thank you.
Hi, so my name is Aparji Desir, and I'm an incoming biostats PhD student. And my 6-word memoir is Let's Listen, Share, and Ignite Curiosities. Since I was a kid, a lot of my friends and my parents and family have called me Curious George because I'm just so interested in everything. I couldn't find a major, and I love to ask questions, especially about other people and to learn about their stories. And I believe that every discipline and everyone has something to contribute. And for me, what inspires me the most is to see that light in someone's eyes when they talk about something that they're passionate about. So that's really what drives me and why I'm here.
Thank you so much. All right, we've got time for one more. Who'd like to share?
Hi, everybody. My name is Bisola Wutunde, and for me, my 6-word memoir is Effective Collaborations That Deliver Healthier Solutions. And I worked in the ER as a scribe after undergrad, and I saw how subsets of populations will suffer from particular diseases, and how most of these things were things that could have been avoided before they got here. And so my thinking was, in light of how diverse healthcare is, that when you see through an emergency medicine physician's population, what he deals with, you as a public health professional, for example, could be like, this is something we could have worked on community level before it gets to this point of emergency. So thank you.
Thank you. And I just want to add, that's such a wonderful point, because I use the example of the autism rates, which leading to the fear of vaccines, and it was something that wasn't addressed that had been going on. And the history of that in Minnesota, as I'm discovering, is then one person went to the community, and that was the person who happened to say vaccines are the cause. So instead of Minnesota responding, we had this one gentleman come in because the community wasn't being listened to because of this pattern. So wonderful point for us to end on. Thank you so much for sharing everything today. And now I'll pass it up.
All right. Here we go. All right. Hello, I'm Darren. I'm with the Career Center. Before I get into the next step of the activity, let's hear it for Emily and Lauren for leading this awesome narrative health activity. Woo! Okay, so in your folders, there should be a story about Abraham. Check behind the map, maybe. Okay. So one of the things that Dean Finnegan talked about, Tim talked about, is this value of interdisciplinary work. You guys are going to get a chance to apply that right now. What I'd like for you to do is, over the next 10 to 15 minutes, you're going to read over this case scenario. And if you flip it over, there are some questions, 4 questions, that as a collective interdisciplinary group, we would like you to answer. At the end of the 10 to 15 minutes, we're going to bring you back together, and we're going to ask a few tables to share. Any questions? Pretty clear, huh? Go get them. Okay, we're going to give you another 1 to 2 minutes. Don't forget to choose a spokesperson for your table. I forgot to mention that. I know. Eeny, meeny, miny, mo. Okay. I always hate to break up great conversation and discussion, especially around this kind of stuff. Hopefully you enjoyed that. One of the things that will be part of your experience through the School of Public Health are a lot of surprises. Good ones. Good ones. And one of those surprises is about to happen right now where I'm randomly going to pick tables. Okay? So hopefully you have a spokesperson. And what we're going to do is on the back of your sheet, there are questions. I should mention that the additional questions are ones for you to continue to consider, take into account this case as you go through your program. Okay. The first table that I want to answer question 1 is Lauren's favorite number, number 8. All right, table 8. Why do you think the emergency department was the first place Abraham thought to go to for care? How might the emergency department improve care for patients like Abraham?
Okay, so we talked about access to emergency room care as being a really important reason why he was able to go there. It's accessible and people know about it. They can't turn you away, and it's 24 hours. So all of those, what else did we put in it? And that we wouldn't necessarily have a relationship with the provider when you show up. And then the second question, how might the ER improve care for patients like Abraham? We talked a little bit about how having kind of a multifaceted approach at the ER, so including social workers, including caseworkers, to talk about kind of home life, to create a broader social history, would all benefit him in his care.
Thank you for sharing. Can y'all do me a favor? Sorry, this thing is falling apart. When you stand up, just say your name.
Yes.
And maybe your
What's your
gender
name?
pronouns.
Eileen Delahand.
Thank
Where are
you.
you from? Awesome. The South. I know someone from the South. Actually, my colleague Vic in the Career Center is from the South, Rochester. Well, thank you. Thank you. Thank you. All right. Question number 2. I feel like we're calling out lottery numbers here. Is going to go to table number 15. Boom. Goes the dynamite. All right. Name.
Hi, my name is Sarah Kettering. I'm from Minneapolis.
Woo!
Yes. And I'm in the community health promotion. The question, why do you think Abraham wouldn't make eye contact with the healthcare team at first? We discussed multiple different things, but mainly within the homeless population, the feeling of shame when you're being outreached and you're on the other end of a helping hand, that there's something that goes along with that. And so the shame that Abraham might have been feeling and making eye contact with 3 strangers who get paid a salary and benefits and might not look like him, wouldn't feel comfortable. Also cultural norms, if there's something there that isn't culturally competent. And how would you build a trusting relationship with people in vulnerable situations? We talked about the power of consistency and showing up. So the fact that these workers went out on a consistent basis and built trust on a regular occurring time period was important. Also the power of food, that they gave something for Abraham to eat was important because it was showing that if you don't have a full stomach, you can't focus on the rest of your health. And I think that's it. Anything I missed, table mates? Okay.
Awesome job.
Thanks.
Thank you so much. Woo! All right, question 3 goes to table 26. Yeah, we don't forget about the back corner.
All right, my name is Noah, and basically what our table said for question number 3 is with Abraham's background, there's a couple healthcare needs that are extra than you would not think about. A big one is with a chronic use of substance abuse, aging, and being male and homeless, he probably has hypertension needs that he needs to get addressed. Other things like substance abuse, he probably needs to go and get like more of a supportive network, kind of like Alcoholics Anonymous or something like that. And for the second question, how do you begin to address these needs on a wider scale? Basically, each person's different, so you have to take a multifaceted approach, not just one giant blanket. So,
awesome. Where are you from?
New Hope, Minnesota.
Nice. Very nice. They got a good Dunkin' Donuts there. All right. You'll find I'm a big fan. All right. The last question. Barriers. Goes to table 11. Yep, that's you. It's okay. You got this.
All right, I'm Grace. And I find the question, where are you from, to be a little bit complicated, but the United States, so.
Nice. Do you know where you're at?
I do know where I am.
Okay.
Yes.
Awesome.
Thank you.
Yeah.
All right, so what are some barriers other populations face in getting access to quality health care? Prisoners, recent immigrants, people with mobility issues, etc. How do you reach these populations on wider scales, and how do you determine which needs to address first? What would your role in these situations be? So, I'll try to distill this into something that we all agreed on. So, I think that we talked about a lot of the social norms that may have to do with, especially potentially a gender bias in the United States, that Abraham may have struggled with, and that transportation, especially in an urban area, would be very difficult, especially as his injuries and illnesses progressed, and that he may live in a food desert, potentially being more than 2 miles from access to food, and closer to somewhere that accepted potentially an EBT card or SNAP, or maybe he isn't even on more of those resources that he could be on. And so maybe some of the first issues that we could address would be to connect him with all of the services that he could potentially use.
Fantastic. Let's hear it. Woo. All right. Well, thank you so much for that. Guess what time it is? Time for lunch! All right. So I'm going to turn it back over to Tim, and we'll get ready to dismiss you for lunch. Thank you so much.